know or are aware of that phobias are the most common mental disease within America. According to Essentials of Understanding Abnormal Behavior, a phobia is a strong, persistent, and unwarranted fear of a specific object or situation. For example, my fear is being fearful of the dark. I become very nervous and anxious when I'm alone in the dark and have worries about unrealistic situations that occur. For example, I'm in my bed sleeping, I hear a noise in the living room, and I assume someone's coming in to kill me. That's an irrational fear. Although this is very irrational, it does not happen frequently, so therefore it is not diagnosable. Although my phobia is not diagnosable, there are many people who have phobias that disrupt their life and cannot function day to day because of their irrational thoughts and fears. Overall, a phobia is an irrational fear that is caused by learned experiences. There's a phobia for almost anything. Treatments can range from drug therapy to behavioral therapy. Most of us are aware of phobias because many of them exist, but do not know the formal names of these phobias. For example, many people are aware of having the fear of heights, my fear of the dark, or the fear of germs. But do you know the formal titles to these? As I said earlier, my fear is being afraid of the dark. This phobia's formal name is nitrophobia. The fear of heights' formal name is acrophobia, and the fear of germs' formal name is microphobia. These are some very common and well-known phobias, but we are just not aware of the formal titles. Some phobias that are interesting but less well-known because they are less common are dementophobia, the fear of being insane, genophobia, the fear of genitals, xenophobia, fear of strangers, and phobophobia, the fear of phobias. Having a fear is perfectly normal. Everyone has a fear or something that they are afraid of. The difference between a normal fear and an abnormal fear is the effect it has on your day-to-day functioning. For example, someone with microphobia, the fear of germs, a normal fear of this is when you see your hands dirty and you clean them as soon as an opportunity presents itself. But an abnormal fear that is diagnosable for a phobia is when they look at their hands and they start picturing these little germs, bugs, eating their flesh away. So they have to immediately drop what they're doing to wash their hands, and will consistently wash their hands to the point where they're overwashing them, drying them out, and their hands begin to be very cracked and destroyed. The Anxiety and Depression Association of America, the ADAA, states, although people with phobias realize the fear is irrational, even thinking about it can cause extreme anxiety. For example, if you have acrophobia, it does not affect your daily life. You just have to make sure you do not go to high points often, and you'll just be fine, or be cautious when you do go to high points. But that would not be considered abnormal because it does not affect your day-to-day functioning. But if you have monophobia, the fear of being alone, it can affect your day-to-day functioning because you cannot function correctly unless you're with someone. This would be considered abnormal and diagnosed with a phobia because they're required to be with someone all times. Our fears are learned from our experiences. For example, when I was younger and I would be sleeping by myself and I would hear noise, this is when my irrational thoughts started to begin. I thought someone was going to come in, kidnap me, kill us, and those were my irrational thoughts began, and they've never left since then. The best way to get rid of these irrational fears is to overcome them by unlearning our fear. In behavioral therapy, you learn to overcome them by being exposed to it. For example, a woman with the fear of being in an elevator will go in with their behavioral therapist up and down the elevator, and the therapist will teach them how to reduce their anxiety levels. By the end of their treatment, they should be able to function completely normal. While in behavioral therapy, they most likely will be diagnosed and be given prescription drugs to help them reduce their anxiety as well. But by the end of this treatment, they should be able to get off the drugs and function normally just as you and I would be able to. In conclusion, phobias impacts everyone's life, whether it's in a big or little way. Phobias can be a struggle, but they can be overcome with appropriate treatment. Phobias are irrational fears, but they can be reduced by learning how to overcome them and with the help help with medication. Phobias are the most common mental disease within America. Overall, they have a great impact in America, but many people are not aware of how serious they can disrupt a life. The National Institute of Mental Health states that 15 million adults are diagnosed with a social phobia, and 19.2 million adults have a specific phobia. What is your phobia?